Bringing a child into the world via a C-section is a major feat. But what happens next? Today, let's explore how to care for your body during this transformative recovery period. A quick but important disclaimer. Recovering from a C-section has both emotional and physical complexity. Everyone heals differently. Please don't be afraid to seek for help if you think you need it. Hey, I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. First, let's understand more about what happens during a C-section. During the procedure, the surgery makes a series of cuts. First through your abdominal skin, muscle, fat, and other tissues, and then into the womb itself. After the baby and placenta are delivered, the most important tasks are controlling bleeding and repairing the wounds carefully. So the first thing that we'll consider is the immediate postpartum period. So that is the first 24 to 72 hours after you've had your baby. The essential things at this time include getting control of your pain and reducing the risk of any complications like bleeding and infection. You would usually have a mixture of medicines to control this, including intravenous fluids and drugs, antibiotics, and so on. The catheter or tube used to keep your bladder empty during the surgery will be taken away. That's to allow you to regain control of your own bladder. Your medical team will encourage you to move around gently to prevent blood clots as early as possible. At the same time, of course, you'll begin to bond with your baby, taking care to avoid positions that put pressure on the cuts in your tummy. So let's look at the first 2 weeks. At this stage, you would have been home for several days, continuing your recovery. The principal things to pay attention to are care for your wound. Keep the area clean and dry. Watch for signs of infection, for example, redness of your skin around the area, a bad smell, pus coming out from the wound area, pain, feeling unwell with the fever, and so on. Also managing your vaginal bleeding. Lochia is the flow from the vagina after having a baby. It is heavier in the first couple of days, but it should begin to get lighter within the first week into the second week. So watch out for any heavy bleeding or a smelly vaginal discharge or lochia. Both of these situations need urgent medical attention and treatment. In addition, you should be having regular meals, taking time to rest in between caring for the new baby, even though I know that is probably easier said than done. I should know. But listen to your body. Accept every offer of help so that you don't feel overwhelmed. Please make sure you're taking any medications that you've been discharged with from the hospital that you were started after surgery. These could be antibiotics, blood pressure tablets, blood thinning injections. These are examples of medicines that women would need depending on your medical background after your operation. Weeks 3 to 6. By this time, baby is 4 weeks old. You should be able to resume light activities like taking short walks. Avoid heavy lifting, nothing heavier than the baby. You likely no longer need pain medicines regularly at this point, but like I said, everybody is different. Having persistent pain in your abdomen that is not relieved with simple painkillers, that requires a medical review. Avoid getting constipated by taking plenty of water, fluids, and fiber, fruit and veg in your diet, and that would help to reduce any strain on your wound during bowel movements. You should also do gentle pelvic floor exercises to help maintain your pelvic floor. Check out this video here where I give some examples. Now, week 6 to 12, as you enter the second month after your surgery, your wound should be healing quite well. You may experience brief twinges of pain when you move, but they shouldn't really be persistent or severe. Some women will experience sensations like a prickly feeling, pins and needles, tingling or numbness around your scar, for several weeks or even months after surgery. Now, this relates to those nerves that were cut during the operation slowly healing. It's also a good idea to think about resuming safe exercises, gentle exercises, if you feel well enough and your doctor has checked you over and has no issues with this. Really important to start slow and then gradually build up your exercise routine. It might take several months before you are emotionally and physically ready for the kind of exercises you were doing before you became pregnant and had your baby. Some women can resume driving around this stage, and sex in certain positions can also start again. I think it's really important to acknowledge that you may be up until this point and even beyond on an emotional roller coaster, because often there's several emotions mixed in with having a baby, even one that is free of any medical complications. From anxiety before you have the baby, with, the process, the relief at a safe birth, worrying about babies feeding, babies sleeping, first days, and so on. There's a lot to think about. But don't worry if you have frequent, brief hormone shifts in the first few weeks. They can lead to mood swings and baby blues, short-lasting episodes, but persistent mood changes, feeling low, excessively anxious, no pleasure, no motivation to do anything, that is a concern. Please speak to your midwife or doctor about this. Some women may have an emergency C-section because of one complication or another. Now, it might take some time to come to terms with the change in your birth plan, unexpected change in your birth plan, and revise expectations after birth. So building a support system regardless, having supportive partner, friends, therapists, online communities is important. Your body has been through such a lot these last 9 months, and there's a while to recover, sometimes another 9 to 12 months more in some cases. Focus on healing. Foods like protein, rich in protein, iron, vitamin C, staying well hydrated is important. Please remember to avoid constipation with foods that are rich in fiber. You can get stool softness from your doctor if you need to. Sleep is so important. Nap when the baby naps. You hear that lots of time. And delegate chores. Accept anybody's offer of help. Whoever said C-sections are the easy way out, did they get that wrong? The reality is that it's a major surgery, it has risks, and it required a longer recovery time than a vaginal birth. You may also hear some helpful advice. You can't breastfeed after a C-section. Well, that's another piece of hogwash. The C-section does not affect milk production, and mothers who've had C-sections feed their babies very well, thank you very much, after the operation. So what are your worries about recovering following a C-section? Let me know in the comment section. Your body has done something incredible and will recover with a bit of time. Let me know what you guys think. Check out this video next, and I will see you over there.